Good afternoon. I have cerebral palsy, which is also known as CP. We'll just get right started. What is CP? CP is the brain damage after birth, and sometimes you can know you have CP right after the birthing, or you might know 2 years later that your child has CP. It all depends on if it's mild, severe, and what type of CP it is. It ultimately affects the muscle tones in your body, and how you move, and also the gross and fine motor skills. Some children who have CP can move their body, can move their arms or legs, and some children cannot move their body at all. It really depends. This is an interesting fact. 2 to 3 children are diagnosed every 1,000 births, and I think that is pretty accurate because 1,000 births is not a lot. There are tons of children being born every single day, and unlike ADHD, which is very common, CP is known, but is not common among, a whole school, where in whole school you might have 20 kids between ages kindergarten and 6 who do have ADHD, whereas you might have 1 to 2 children in the school who have CP. So it really just depends how you look at that. We'll hop on to the symptoms of CP, and which include the lack of muscle movement, like I've said. It can either be stiff or tight muscles, and if you have a stiff muscle or tight, it can really affect your movement. Also with loose muscles, you can have muscles where you might not even be able to move at all. Like you might have a hand where it won't move, but it also depends on the type of CP, like I've said before. You can have the weakness in a leg or arm, which is on one side of the body, depending on the type, or it can be the whole body. Drooling is super common with CP, especially more of a severe CP, and that also helps, like the movement or the muscles in your mouth can help not be able to speak or swallow, and with swallowing that affects their eating, which is not very good. You can also shake when you have CP with tremors. That one is mostly not as noticeable when you have the more mild CP, but more in the severe CP. The delay in motor skills is pretty much shown in all types of CP, and that just depends on if you're looking at gross or if you're looking at fine. You can have a mild type of CP where you might not be able to cut your scissors right away because of how your muscles are functioning. Difficult in movement. Can be super hard for children who have CP to move. We'll talk about the scissor-like effect when they're moving their legs, or if a child cannot even move at all, they might just be stuck in a wheelchair, which is very difficult to see. They also can be developmentally delayed, which is a symptom of CP, and this is more towards the severe type. The intellectual development is very hard to acknowledge when you're looking at the last type of CP in spastic quadriplegia, and it is hard to notice that when it's a mild case that they might not have CP, looking at their developmental delay, but then you'll notice of their walking or their movement of their muscles, which is why it's a huge symptom in both, in all types of CP. Looking at this, we're going to talk about types of CP, which there are 5 different types. Let's look at the image. There's monoplegia, hemiplegia, diplegia, and quadriplegia. We'll start with the mono. It means one, so it affects one limb, which is usually the arm. This is not very noticeable when you're looking at kids. Hemiplegia, it affects the one of a whole side. So you can see in the picture, there's the body, and it's obviously the arm and the leg, and it affects half of the brain. So it really depends on, and that one, it can be either mild or severe. The diplegia, it affects either both the arms or both the legs. It's not both arms and leg, it's either arms or legs, but it affects both of them. And the biggest, severest type of CP is quadriplegia, and it's the whole body. The whole body is affected: arms, legs, brain, body, legs, everything. So we'll talk about that too. So the first one is spastic hemiplegia, and that is the effect of the arm and hand only on the one side of the body. The children who have this type usually are tiptoe walkers, And tiptoe walkers are usually only walking on your tiptoes when you walk. It's because of the tight heel tendon, and this is also known as sometimes scissor-like. You go back and forth with your hips and on your tiptoes. Scoliosis is also a huge symptom of this type of CP, also with speech delay. We will talk about scoliosis in all of the types. Our next one is spastic diplegia. It involves the stiffness of muscles, which is dominant in the legs. This one is mostly legs or the arms, but we'll talk mostly about the legs. That's where it's usually found. The toes go up. At the bottom of the foot, it's just like the scissor effect, like I was talking about the type of 4, mostly going back and forth with your tiptoes. This condition can cause children to rely on walkers or leg braces. I've noticed a lot of leg braces being used during my research, and I think that children would rather have leg braces than walkers just because of the formality. They see themselves as being weak, but they want to be more on their own, whereas walkers is more extra help. We'll go to the next one, which is spastic quadriplegia, and like I said before, this is the most severe. Children who have this disability have severe stiffness and pain, floppy necks, weak limbs, may not ever walk, speech is difficult, or they can't talk. Seizures are very frequent. Scoliosis is shown and intelligence levels are very low. I will talk further in this presentation about this spastic quadriplegia. I knew someone that had this. Well, I didn't know, but this is the hardest type to see a child suffer through. Your head is, you can't really move your head. You can't really move your body at all. And being stuck in a wheelchair, being stuck in something, not being able to move is super difficult to see. The person who has this type of CP may never ever talk. They may have from 5 to 15 seizures a day, depending on the day. Their scoliosis is really bad. Either it's a humpback, a curved back, or a back that is more hunched over. So after spastic, we'll talk to dyskinetic tic. It's a characteristic by slow and uncontrolled withering of jerky movements or hands, feet, arms, or legs. This is more of a movement of the CP. These children can also have difficulty hearing, speaking, breathing, and eating. Like I said before, the muscles in your mouth is huge, especially for children who cannot speak, breathe, or eat, because if you can't get the nutrients into you, that's super hard to see. And to realize that children are having that difficulty is very sad, very sad. So the next this is the last type of CP, ataxic. It mostly affects the balance and depth perception. It can be hard to walk and stay balanced. Children, you can notice these movements that children do. They might grab a wall to make sure they're keeping balance. They might hold on to a person if they're walking. But this type of CP is not very shown or known. The more of the other ones are, just because it's easier to see, if you're an outside person who does not have this disability. We'll go next to associated conditions. Seizure disorders. Seizure disorders are a huge deal with CP. No matter what type of CP, there's always a chance of having a seizure. You can either have a seizure 1 time a day, 5 times a day, or 10 times a day. And it depends on if it's mild or severe. Intellectually being impaired, that's mostly on the severe type. Growth and developmental delay, spinal deformation, chronic pain, vision impaired, hearing impaired, and speech and language difficulty. With the chronic pain, this really affects every single person who suffers from CP. Having that muscle tone, that not being able to move, not functioning fully or correctly, that pain in your back, the pain in your head, the pain in your arms, pain in your muscles, pain in your mouth, it really affects who you are as a person. Treatment is the next thing we will talk about. A child with CP will have specialized individuals working with them pretty much 24/7. You will have the pediatrician, who you will most likely see maybe once every 2 weeks, pediatric neurologist for the brain, physical therapist, which is PT, and then we'll have the OT, occupational therapist, speech and language pathologist, developmental therapist, recreational therapist, social worker, and when your child is in education, a special educator. Now, the most significant one you will probably see a child with CP use is the PT and OT, and speech, if they're having a speech problem. Those 3 people will probably likely see maybe 2 to 3 times a week. It really needs to help that child grow as an individual. Even just a little movement will be a huge success. Other therapy, there are some oral medication that can be treated to help relax or stiff muscles. Because either you want stiff muscles or you need to relax muscles, depending on where you are at with the CP. Surgery is also an option to help stiffness and pain. With surgery, they mostly are cutting the nerves to release the pain or to move the muscles. And it depends on what type of CP you have, which makes you able to have surgery. Being diagnosed. So being diagnosed with CP can either be difficult, hard, or easy. So depending on the birth, diagnosing can take up to 5 years of age. Usually you'll know by 2 years old. If the child is not breathing when born or is stuck in the birthing canal, there can be some testing done. So a cranial ultrasound, computed tomography, MRI, or electric phonogram is tested if after birth there seems to be a problem. I will talk about these types of testing when I talk more about the person I knew who had CP and how that person knew that they found out that the child had CP. At the image to the left, you can see figure 1. That is a normal brain from a cranial ultrasound. And then the figure 2 on the right is the bleeding of the brain, and you can see that there is liquid around in the brain, which helps identify that there's something wrong and that this is not a symptom, but acknowledgement of CP being shown after the birth of a child. So let's talk about my connection. The reason why I picked CP for this research project was because I had a brother, a half-brother, who had CP. His name was Andrew Charles Vallum. Andrew was born July 17th, 1990. My mom had him, and she was prepared for a pregnancy. There was nothing wrong before, but when she started to go into labor, she's pushing, and Andrew got stuck in the birthing canal. His head was out and half of his body, and they could not get him out. He was not breathing at all. Nothing was showing that he was even alive. Like, it looked like he was just a dead cucumber. It's sad to say, but it's true, as my mom hasn't told me about it. She told me that the doctor hopped onto her, started giving my brother CPR right away, even when he wasn't even fully out. And when he got rushed to the emergency NICU. There was tons of wires all over him, IVs in him. They finally got him to breathe again. And my mom had told me, like, when she didn't get to be able to see him for a couple days because it was really bad. She was also not well after her pregnancy, so she had to stay in the hospital for a while. She talked to me about, she got told to go to many different doctors for Andrew, and they were all at different hospitals. They all had a very huge connection with him. There was a doctor who had a stack of papers for Andrew that had all his ultrasounds, all his testing, everything. And they pretty much told my mom that he would never be able to walk, he would never be able to talk, he had a hard time eating out of a bottle, so because of his muscles in his mouth. There was an age limit that he would probably reach would be 12 years old. As you can tell, he passed away December 20th, 1992. Andrew had seizures all the time. One day he had 10, and every seizure you have, your brain cells start dying. And when he did die, his brain just like deflated like a balloon, and all the brain cells were just gone. This really affected me when my mom told me this when I was younger, and I've always been super interested in cerebral palsy and knowing how it affects children and how it affects people. And I think as I've grown knowing about CP and my brother, I think that yes, it affects the child with CP, but it also affects every single person who's involved in that child's life. My mom worked her butt off to pay for all the medical bills. He was at St. Paul Children's, Gillette Hospital. She had huge medical bills. My grandma and grandpa helped my mom out a ton. They were connected to my brother. My aunt and my uncle would always babysit. We had families and friends and everyone. And the biggest thing was just hoping and having faith no matter what. And no matter what, you can always just hope. And that's what they did. But obviously you can tell that there was a different intention. And he's off in a better place. But knowing that there is no cure for CP is really hard. But you can always just try. And giving love is the biggest thing, I think, to give anyone with a disability, because they're different and they know that, and they'll never be like everyone else who is normal. So I want to thank you for watching my presentation. This is a great research project that has ultimately shown me how much information is out there and how much different people research, and CP is a huge thing. Just like, ADHD, just like mental health issues. And I think that I've learned a lot from CP, and I hope you did too. Thank you.